Hello and namaste. Good afternoon or good evening to wherever you are. We have a special webinar today on psychiatric pluralism and Ayurvedic perspective. We are doing this webinar at a special time when India is actually going through the second wave of the pandemic crisis. We are praying for all the people's lives and the sufferings that people have actually experienced, and also the valuable lives that people have lost. We pray for a speedy recovery for all people in India and to bless us all with healthy lives for the future and a recovery from COVID. So in this time, mental health and well-being is crucial in terms of how we keep our outlook with a positive manner in whatever ways possible, using different ranges and methods that we adopt to keep ourselves happy and healthy. So this webinar is actually on mental health literacy and how we promote mental health literacy in Kerala and the rest of India through a range of methodologies. And I'm Raghu Raghavan. I'm a professor of mental health at DeMontfort University in Leicester, and I lead a UK Research Council funded program on mental health literacy in urban and rural communities in Kerala. The reason why we have chosen Kerala is because of the fact that in Kerala, despite all the health advances and the human health index in Kerala is pretty high, but regardless, there is higher incidence of mental illness and suicide rates in Kerala. That's the reason why I've chosen Kerala as a study site. And we have been working with the communities, urban and rural communities in Kerala over the last 3 years or so, using dramas, films, and other creative methodologies in terms of participatory approaches to try and understand the cultural, social, cultural constructs of how mental health literacy can be informed. Because mental health literacy is a Western concept, and we are trying to try and see how this might actually work within the Indian context. So we have a number of partners that we work with in the project. We have partners from the UK, from my own university in DeMontfort University in Leicester. We also have partners from Loughborough University, which is also in Leicester or Leicestershire. And we have partners from UCL in London, Middlesex University in London. And also we have theatre partner from Nottingham as well. From the India side of things, we have partners from the Tata Institute of Social Sciences, from NIMHANS, and also from the two NGO organizations that we work with, the Mental Health Action Trust based in Kozhikode, and the MeHeLP Foundation based in Kochi. In addition to that, we also work with Mr. Chandradasan and the Logadame Theatre Group based in Ernakulam. So we are a big team of people who have been working together for the last 3 years or so. We have been on and off because we haven't been able to do any face-to-face work because of the COVID context. But regardless, we have been able to do most of the work that is possible. Technology has got its own advantages in these things, whether you are actually living in rural, tribal, or urban area. It doesn't really matter. Technology can actually reach those people, and hence we have been able to advance our work with those communities. So the project actually finishes on the 31st of October of this year. So we hope to try and engage with people if it is possible in the current context on a face-to-face, if not on a digital manner later on in the year. We have two distinguished guests with us, Dr. Parvatheedevy and Dr. Hari Bhaskar, and I will introduce them both in a minute in terms of how they're going to take this webinar forward in terms of the discussion. This webinar is also streamed live on Facebook, so welcome to all of you who have actually joined both on Zoom and also on Facebook, and please do raise your questions through the question and answer tab, and also we'll have a very interactive session in discussing psychiatric pluralism. Just a word about mental health literacy. What is mental health literacy? because it is a Western concept, as I actually have said. It plays a major role in how we actually understand mental health and mental illness, because mental health literacy is not just mental health awareness. Mental health literacy is actually more than mental health awareness. So there are 6 components of mental health literacy. It is our ability to understand and recognize specific disorders or different types of psychological distress. Secondly, it is the knowledge about the risk factors or the causes for mental illness or mental health disorders. And thirdly, it's about how we create self-help approaches in terms of preventing mental illness or creating mental health or addressing some of the distress that we may actually have. And fourthly, this is about knowledge about professional help that is actually available in a different pathways of professional help that may be available. And I think that is where today's webinar is actually very crucial in terms of understanding a different way of actually addressing mental health disorders. And fifthly, we look at attitudes which facilitate or promote the recognition of mental distress. The stigma around mental illness is actually vast, both in India and also internationally speaking, and how we eradicate it, how we understand it, and how we overcome that is actually quite crucial in promoting mental health literacy. And finally, we also need to have a better understanding of the knowledge about how to get the right kind of information about mental health, well-being, and mental health disorders. Because I think there's a lot of information that is not true around in more the digital platform and also in the print media and the visual media. But I think it's important to know what is the right kind of information as well. And low mental health literacy is often associated with more stigmatizing attitudes, as well as increased delays in actually help seeking. And hence it is important that we actually discuss and understand and become more competent with mental health literacy knowledge. So that is actually in summary about our project and what we aim to do in propagating the message around mental health literacy. Now, I have great pleasure to actually introduce our 2 distinguished guests. I may introduce Dr. Parvatheedevy first. Dr. Parvatheedevy, welcome on board. Thank you for accepting our invitation to be on this important webinar on mental health literacy and psychiatric pluralism. Dr. Parvatheedevy completed her Bachelor of Ayurvedic Medicine and Surgery program from Vaidyaratnam Ayurveda College near Trichy. And she has completed the Master of Science in Psychology from Madras University and her MD in Manovigyan, which is Ayurveda Psychiatry from VPSV Ayurveda College in Kottakkal from the Kerala University of Health Sciences. Dr. Parvati was the medical officer at the Government Ayurveda Institute for Mental Diseases at Kottakkal, and she is continuing to work there as a superintendent in the same field. Dr. Parvati has convened many national seminars on Ayurvedic psychiatry in India, excuse me. And she's the state coordinator of projects on Manovigyan in 14 districts, Jyotirgamaya in 3 central prisons and at Hashan depression clinics in 6 districts of Kerala under the Department of Indian System of Medicine and National Ayush Mission. She has initiated steps for eradicating mental disorders in specific villages called Manashwasta Gramam. And she has also initiated work with schools and used creative means for starting rehabilitation units in Government Ayurvedic Research Institute for Mental Diseases in 2016. So welcome, Dr. Parvatheedevy, to the program. I now have great pleasure to introduce Dr. Kumar Bhaskar Nair, who is a friend as well as a professional, and he serves as the medical superintendent of Ayurvedic hospitals run by the Nair Service Society, a social and educational charity in Kerala. And he has been coordinating the NSS Ayurveda hospitals in Kerala since its inception. Dr. Hari is also an affiliated researcher and a PhD candidate at the Athena VU University in Amsterdam. Besides this, he also serves as the chairman, Institutional Review Board, the Pushpagiri Institute of Medical Research Center, and he is also a member of the Ethics Committee at the Department of Indian Systems of Medicine and also the Government of Kerala. He has taught at I think it's Vijayalanka, that is Vijnana Kalavedi Center. That's right, Vijnana Kalavedi Center for Cultural Education, and the Mar Athanasius College for Advanced Studies, Tiruvalla in Kerala, for on the faculty for and also he was in the 2008 Prince Charles Foundation for Integrated Health Ayurveda Study tour to Kerala. He completed the Masters in Health and Society in South Asia program with good academic credentials from the South Asia Institute, University of Heidelberg, Germany. He has delivered talks at the outpatient clinic for natural medicine and the Department of Informational Health, University of Heidelberg, the Department of Indology at the University of Copenhagen, Denmark, and the Department of Humanities and Medicine at Hong Kong University, and the British Association of Accredited Ayurvedic Practitioners in London. Furthermore, he had a special citation in the Charles Leslie Prize at the 2009 Annual International Association for the Study of Traditional Asian Medicine Conference in Bhutan. So welcome, Dr. Harry, to the program. So thank you very much for both of you to join the program. Now, the way you have structured the program is that we would have a 5-minute talk by Dr. Parvatheedevy first, and then by Dr. Harry, and then we will go into the kind of interactive discussion mode on psychiatric pluralism with Ayurvedic perspective. So over to you, Dr. Parvatheedevy.
Thank you, sir, for inviting me in such a session. Let me start. From the definition of psychiatry itself, or mental health itself, there is a social element. It's saying that who is able to make a contribution to the his or her community. From the WHO definition of mental health itself, there is a social element in mental health, and this mental health acts in tune with social norms. And also in mental disorder, there is a psychosocial model, biological and psychological and social model. And then always there is a role of society in defining a mental disorder or causing a mental disorder and curing a mental disorder. There is a role of society. So a pure physical treatment along with the involvement of society is needed in the treatment of mental disorder. So this pluralism, I think it's in Ayurveda itself, it is saying that some Deva Vyapashraya, Yukti Vyapashraya, there are 3 types of treatment for all diseases, especially in mental disorder. There are 3 types of treatment is there, and the role of society is important, because in pluralism it is saying that there is a folk a folk sector, and then popular sector and professional sector. And Clement's definition, according to the definition of pluralism, these 3 types are there. Then that folk sector plays an important role in the treatment of mental disorders in the mainly in Kerala. So there are many traditional healers. More than that, this society, that if a person has some psychiatric illness or some psychological issues, the society is saying that one who is not acting or not behaving according to the rules of the society is thinking that the person is not psychologically normal, and the involvement of society is more in the case of mental disorder, and what to do, or they are thinking that to isolate the person or whatever it may be. So the role of the society is more. like that, this we can say that this psychiatry or the medical clinical pluralism is more in psychiatry other than than other disorders, in psychiatry more than other disorders. And coming to Ayurvedic psychiatry, the treatment itself, I told that there are 3 types of treatment: Deva Vyapashraya, Yukti Vyapashraya, and Sattva Vijaya, and these are interrelated. This Deva Vyapashraya is pure spiritual treatment, spiritual healing. Yukti Vyapashraya is the medical, is the intervention by medicines, and Sattva Vijaya is the counseling, psychotherapy, at that type of methods. And always this Deva Vyapashraya plays an important role in the treatment of mental disorders, because now even in this century, in this modern era, people are thinking that there are some evil spirits or some unknown factors that are causing mental disorders. And once we have taken a cross-sectional survey in our hospital within the patients, and we saw that more than 60% of the patients first visited a spiritual healer. And after that, only they are coming for a modern treatment or an Ayurvedic treatment. Really, their third option is Ayurveda. Mainly in Kerala, I can say now the fact of Kerala. First, they will go to, even though the patients and bystanders are highly educated or whatever it may be, they will first go for a spiritual healer, and then they will go for some modern medication, because they want to hide, because of this social stigma, they want to hide the disease. So first they want to control the disease as soon as possible. They first go for some modern, then they go for some medical treatment, and then only they are aware that we want some Ayurvedic treatment, we want some better mental health, then they are opting Ayurvedic treatment. And so this society, mainly the people around them, they are also, this concept is there, these mental disorders are because of some evil spirits or some something beyond our control. So all of them are telling that you just go there. And some traditional spiritual healers are there in this in each community. There are some spiritual healers in Muslim community or Hindu, whatever it may be. There will be some spiritual healers, and they will first go for this spiritual healers, and some astrologers. What is the cause of the disease? Because it's psychological, they don't know how it happens. First, then they go for to consult an astrologer, and these astrologers, they will not tell that you have to go to consult a physician, it's purely a disease. They will not tell like that. They will tell some there are some sort of black magics or something happened. You have to undergo some spiritual healing, and then after that you just go for a treatment. There are two things. First, if they have a small belief or slight belief is there, then it's easy for us, because the astrologers are referring the patient to us, and the astrologers will tell that your the problems in your astrology or problem is in your star, it's okay now, then you consult a physician, then it will be cured. Then the patient is coming to us with a firm belief that it will be cured with the treatment, because all the other evil spirits have gone, and we have to do the treatment, then it will be cured. And the patient has a belief like that. But if it is a slight belief, it's okay for us, it's beneficial. Then the people are believing our treatment, or they are thinking that with this treatment they will be cured. And even with a slight relief, they are thinking that it's okay, we are getting good relief. But if they have a strong belief, they will not go for treatment. They will do all the spiritual healers. So they will consult one and other spiritual healers, and the disease will be go on like that. If it is a purely psychological, and so it's not a pure it's not a psychological disorder like severe psychological disorder, it will be controlled. But if it is a strong psychological disorder or psychosis like schizophrenia or bipolar disorder, they have to undergo treatment. Oh, such like that, a slight belief is okay, but if it is more, it's very dangerous. And after the treatment, and in our treatment also, there are some some spiritual elements are there. While doing treatment, while doing Vamana, I shall describe more in the other sessions. While doing the treatment like emesis, we are mainly practicing Panchakarma therapy, that is purificatory procedure. And according to our according to Ayurveda, the mind and body is very much related, and the purification of mind, purification of body leads to purification of mind. That is the base of treatment of mental disorder. You just purify your body, then the mind also become purified. So the purification of body is with this Panchakarma, these 5 procedures. That is emesis, vomiting, treatment, medicine-induced vomiting, then purgation, and then enemas. 2 types of enemas are there, then nasal medication. These are the 5 purificatory procedures. And after this purification, the mind also become purified. And this treatment also, this purificatory procedures like emesis or vomiting, the people are thinking that there are some poisonous material inside their body has gone out with this emesis or vomiting, and because of that they are getting good relief. Even though it is a pure physical treatment in Ayurveda, described in Ayurveda, there is a psychological factor in this treatment also. So all these factors are mixed in this Deva Vyapashra spiritual treatment is mixed with this, the elements of that is mixed with the physical treatment also. So we cannot differentiate these 3 types of treatment in the case of psychiatry. Then I think after the talk of Dr. Hari, then I can describe more about the treatment. Okay.
Interesting.
So you are mute. No. Okay.
I think that thank you very much for that. It's interesting. I think how the people perceive the purification process and how the treatment modalities actually constructed based on that is very interesting. Can I go to Dr. Hari Bhaskar now, please? Hari, could you have your view of how Ayurvedic perspectives influence mental health awareness, mental health treatment, and also how it has made contribute to psychiatric pluralism, both in India and also internationally as well.
Thank you, Professor Raghu Raghavan. Sir, can you hear me?
Yeah.
Yeah. So first of all, I would like to caution Dr. Raghu Raghavan and all others. I'm sitting in an area where there has been thunder and lightning all these evenings. So if I am disappearing immediately, please don't panic. It's just the power lines are gone. Already, even yesterday, our inverter have gone with the thunder and lightning. But anyhow, it's the midsummer rains in Kerala. So see, psychiatric pluralism is interestingly my PhD topic, which I have chosen out of my own curiosity. So the curiosity started when I saw first Professor Murphy Halliburton walking through the Ayurvedic college where I have been a graduate student in Trivandrum. So we had a short interaction with Professor Murphy Halliburton, who came there often to visit Professor Sundaran, Dr. Sundaran sir, who was our preceptor, who was our professor there. So if you have, anyone of you have read the Mud Pack and Prozac from him, you would have read about Dr. Sundaran sir and all these sessions he had. I'm sure Dr. Parvati would also have seen Murphy in her tenure at the Kottagal Hospital when Murphy was visiting that hospital as well. So inspired by what the anthropologists were doing, even in my graduation years, later on when I had an opportunity to visit Germany and pursue my master's in medical anthropology there, I was interested in psychiatric pluralism, and my master's research was also based on that. So having said that, I would like to explore a little bit on psychiatric pluralism in general, and that also how it is linked, or how it could be, Ayurveda could be contributing to psychiatric pluralism, and also the larger project of psychiatric pluralism in Kerala as explored by Murphy Halliburton and others. So first of all, when you speak about psychiatric pluralism, you think about the famous article by Kendler. You know, I was reading this article again and again, where Kenneth S. Kendler was trying to introduce the different facets of pluralism. As you may be aware, Kendler was one of the biggest names in psychiatry and also in connecting genomics to psychiatry. But he attempted on creating a philosophical basis of psychiatry. And in this attempt, he was arguing for nothing but pluralism in psychiatry. And then he said, you cannot completely depend on the somatic or genomic model of psychiatry, but you have to consider several aspects of it. And then it should be an explanatory pluralism, which you should be arguing about. So Kendler said there are psychological factors like, say, humiliation, grief, etc. There are cultural factors. He gave the great example of bulimia and all that. And then genetic factors, of course, like the interrelationship of genetic factors with what we presume as familial or personality related factors. So he argued later for what you call the integrative model of explanatory pluralism. I'm damn sure that those who are interested in psychiatric pluralism and those who are in the field definitely knows about all this. But why I am trying to bring in all these discussions is because it ends there, or I will say it begins there. But when we consider psychiatric pluralism in Kerala or in Ayurveda, it goes out of the perspective. You know, when we speak about psychiatric pluralism in this international nomenclature, as explained by Kendler and many others, they speak of accepting the psychological model or the explanatory model and limits itself there. Whereas when, as Murphy says, when it comes to developing country sites or places like India, it broadens. Like it could be not just the psychologist and the psychiatrist, it could be even the astrologer, as Parvati madam has been rightly pointing out. So it is the traditional healer, it is the Ayurvedic physician, it is the astrologer, it is the priest, it is the Tangal, who is the Muslim priest, and many others. All of them play their own roles in what you call the geography, or you can say, like Appadurai said, in the ethnoscapes of healing or ethnoscapes of psychiatry. All this comes to play. So interestingly, as Murphy pointed out, Murphy Halliburton pointed out, there is this the right fitting hat you can choose. You have the Ayurvedic model, you have the Western biomedical model, you have the psychologists who are working, And I hope you understand that Kerala is one of the places where you have the highest number of psychiatrists and even the psychologists, availability of psychologists in the rest of India, among Indian states. So you have these options, but at the same time, you have also Ayurveda, you have homeopathy, you have ritual healing, you have temple healing, you have these religious healing sites where Murphy did his work, and also astrologers and such people also mediate a lot of this work. So I would like to argue, it was one of the main arguments of my paper, which is of course not yet published because of many other reasons. But the main argument was that the Keralan self, I'm not arguing for the rest of India or the whole India, but I will at least argue for the Keralan self is a pluralistic self. And this expressed a lot in even the reflections of elections which we had in the last days. We have plural selves. We are not sticking on to something. We are at the same time, we are communist, but at the same time, we are very ritualistic. At the same time, we are very progressive. We argue for all the good ethical human values, but we look for our horoscopes before getting married. We are one of the best educated people in India, but at the same time, we are easily affected by simple facts and factors in life and commit suicides like that. So we are people who are plural selves. At one point, we could be the ghost. At the other point, we could be the gods. So gods on country, but sometimes it could be a ghost on country as well. So this is what I will argue for a plural self of Kerala. So the plural selves, going back to the anthropological scholarship on it, I will say, the concept of Rashi Purusha, Parvatheedevy madam could be knowing more about it, because Rashi Purusha, Rashi is like the heap, which is the heap of the conch shells, which is moved by the astrologers. That is what he called the Rashi, the conch shell, the heap of that they move. And the Rashi Purusha, which is that your individual self is constituted by multiple factors. That is the concept of Rashi Purusha. That is the argument which is by Joseph Alter, who is an American anthropologist who spoke about the construct of the selfhood in Ayurveda. And also the plural selves, I will also argue that there is a continuum of selfhood experiences from the body to the mind and consciousness and even to the soul, which is argument put forward by Murphy Halliburton, who say that the Keralan self is not just limiting from body or mind or consciousness, it even transcends to the level of the soul, which is obviously very interesting argument which he is making, Murphy Halliburton is making. And I will just limit myself in one more point, which is in my personal experience in doing my master's fieldwork in Pungudilmana, which is a traditional healing practice in North Kerala, very near to Parvatheedevy ma'am's institute, which is funded by Kerala government, which is very near in the same district. So they treat, at the point when I was doing my research there, they were not having an inpatient section, but they were having a sizable outpatient arrivals there. And interestingly, it was not the main problem for which people coming there was not for mental health problem. It was to evade or ward off the problems which they presumably had with Brahma Rakshas. Brahma Rakshas is considered to be a soul or a Brahmin soul living in and around the soil, in and around your house, in the soil or in the vicinity of your properties. So if you don't pay a tribute to the Brahma Rakshas and contain the Brahma Rakshas annually, you are supposed to have certain problems. The problems first affect your cattle, and then it slowly starts affecting the human beings. Like you have small headaches, you have back pains, you have an uneasiness, this and that. So people were coming there in large numbers. And I'm not speaking about many years back. I did my research in 2010, 2009, 2010. And even now, I believe that Brahma Rakshas is still one of the main problems or presumed problems for which people flock up there in this traditional healing center, among others. So, so the point is, what we think are the reasons of our suffering may not be the reason someone else is thinking as a reason of his suffering. And having multitude of options definitely could help someone in choosing the right option to deal with one's own suffering, to give meaning, and also to deal with one's own suffering, which is basically the argument of medical anthropology. And I think rightly said Kleinman and others on this. And I think I will limit myself there, and I will be looking forward for any other interaction. Thank you, Raghu sir.
Thank you, Dr. Hari, for explaining all those concepts for some people who actually strictly follow the allopathic medicine, or we follow the global Western model of mental health. It might be very difficult for us to actually understand some of those things. But I think regardless, and I think it is a practice, it's a system, it's a practice that's been going on for centuries, and some of it is actually tested. Some of it is stone tested, because I think not everything has to be tested. So I think that's the way we have the system. So thank you for explaining that system. And I think Halliburton have always said that sticking to one methodology alone is not the answer for mental health from a global perspective as well. I think there is no, in the field of mental health or mental health and mental health disorders, there is no one country in this universe that has got a monopoly on things, because all countries are developing countries in terms of how we see mental health and mental illness, and how we actually try and approach them from different cultural or non-cultural or biomedical perspectives. So let's open up for discussion in relation to some of the points that you have actually raised. So in terms of the popularity of Ayurveda, and how I would like to kind of see how do people normally come to the Ayurvedic practices in the first instance, and how does it actually relate to the urban and the rural communities? Dr. Parvatheedevy?
Yeah. So, pardon, can you repeat the question?
The question was, how are people, obviously Ayurveda is popular in Kerala, and then also maybe popular in other Indian states as well. But I think how do people prefer to come to Ayurveda as a first option, rather than going to see a psychiatrist or using allopathic modality?
Yeah, people are coming directly to Ayurvedic. They are directly approaching Ayurvedic treatment for psychiatric disorders. It's there, but I think like all other diseases and like all other systems or all other states in Kerala, they are preferring modern medicine. But if a person is getting good relief with Ayurvedic treatment, their relatives or by their contact, they are directly approaching to our treatment. Some people, but I think most of the community are not aware about the Ayurvedic psychiatric treatment, because our hospital is the only one institution under government sector in Kerala, not in Kerala, in India. That's the only psychiatric institution, and all the people in Kerala are not aware about this institution and about the Ayurvedic psychiatric treatment. They know that Ayurvedic treatment is for other diseases or some Vata diseases or pain like that. But Ayurveda is good for mental health, and Ayurveda is good for psychiatric disorders. The factor most of the people are not aware. and the specialists are very less. The Ayurvedic psychiatric specialists are very few in number. So the availability of an Ayurvedic psychiatrist is not there as much as modern psychiatrists. That's the problem of Ayurvedic psychiatry. But people are approaching directly to our hospital. And this type of some spiritual healers are also directing or they are referring to us. And also other Ayurvedic physicians are referring to us. But what is the difference between the other treatment? We cannot say that one treatment is not good and the other is good, like that. We cannot grade. But the benefit of Ayurvedic treatment is they are getting, even though the patients are taking lots of medicine and it's a very chronic disease, they are getting good quality, improvement in their quality of life. We cannot say that all the diseases can be cured by Ayurveda, because there are some severe mental disorders like schizophrenia, bipolar disorder. Even though the disease is very chronic and very severe, they are getting good improvement in their quality of life. They can live better than before, or before the Ayurvedic treatment. And after the Ayurvedic treatment, they can, because of this quality of life improvement, they can live better. And they have to continue the Ayurvedic medicines for a long time. Depending upon the disease, they have to continue the Ayurvedic treatment. And the modern medicines also, we can taper with the help of a modern doctor. We are trying to taper the dose of the medicine. So after tapering the dose of some antipsychotics, this drug-induced Parkinsonism, like the extrapyramidal symptoms are also become, the symptoms are also become reduced, and then because of that also they can live better and they can do their work properly. And this type of improvement, we can see this type of improvement. And depending upon the rural and urban area, I think there is no difference between the patients coming from rural area. All the people from rural area and also the urban area are coming for treatment. And in the depending upon the or education status also, all the type of people are coming with low educational status, and with high modern doctors are also coming for our treatment. That there is no difference between this type of socio-economical status. It's not there.
It's interesting that you actually said that there's only one place in India, there is only in Portugal where you have Ayurvedic psychiatry treatment or facility in India, in the rest of India. There are no other places in India where they have Ayurvedic psychiatry?
No other hospital under government sector is the only. And in private sector also, there are no much hospitals in private sector also. It's not there in Ayurvedic, under Ayurveda, it's not there. And as a joke, our family members used to tell that this pluralism we can see in our family also, because the modern psychiatrists of this Malappuram district, our hospital is situated in Malappuram district. My uncle was the modern psychiatrist, and the Pookudil Mana, the spiritual healers, are also our family members. And all these treatment are available in our family also. This modern treatment, Ayurvedic treatment, and the spiritual healers are in our family. So the psychiatric pluralism we can see in our family itself.
That's interesting. It's a very interesting story, and I think it's not that. I think it is very interesting. So you have the wealth of knowledge in relation to all systems of medicine within the field of mental health. Excellent. So can I come back? Can I come to Dr. Hari, please? In relation, do we have any from an evaluation perspective? How do we evaluate how Ayurvedic practices may have actually helped somebody to overcome or recover from mental illness? And do we have any kind of research? Do we any kind of evaluation studies or other things based in the Kerala context?
I'm not completely aware of the studies which have been undertaken in the Ayurvedic colleges in Kerala or in India. I'm pretty sure that there would have been several studies done by the MD Manasika Vijnana students all across India and all across Kerala as well. I think in Kottakkal only, maybe in Trivandrum also, they have the MD Manasika Vijnana. Parvati madam, is it only in Kottakkal?
No, only in Kottakkal. In Kerala, only in Kottakkal. And in Karnataka, there are 3 colleges. Yeah. But MD Manasika is there. Yeah. They are also, we are providing clinical training for the students of all the 4 colleges. Yeah.
So,
so the PhD studies are also there
going on,
and I mean there are researchers going on. PG dissertations and PhD researchers are also going on based on Ayurvedic psychiatry. Some drug researchers are there, and the treatment protocol researchers on treatment protocols are there, and then some scale development of rating scales and other type diagnostic criteria, development of all these diagnostic tools are there. That type of researchers are also going on. I have done my PG on developing a assessment tool for Sattva Bala, that is mental stamina. Yeah. There are 3 types of mental stamina described in Ayurveda. That's one is Pravara Sattva, that is strong mental stamina, and Madhyama Sattva, it's a medium mental stamina, and Hina Sattva, that is poor mental stamina. And it is described in text that the Hina Sattva persons, the persons with poor mental stamina, are vulnerable for mental disorders. And I have examined how to assess the mental stamina of a person. There are some descriptions about this Hina Sattva, poor mental stamina, and these persons are vulnerable for mental disorders. So we can select the persons with poor mental stamina, and then we can give some medicines or Sattvavajaya therapy. So then Sattvavajaya is improving their Sattva Bala, improving their mental stamina. Then we have to do intervention to improve their mental stamina. Then we can prevent mental disorders. That is my study, and as a part of my study, I have a comparative study was there. Then, according to astrology, there are some factors in some dashi we can assess the this weak mental stamina according to one's horoscope. Then I have randomly selected some persons, students, patients, and some laymen. Selected the persons, and then with their astrology, I assessed their mental stamina, and the assessment of mental stamina was done with this tool, assessment tool also, and comparison was done with the help of an astrologer, and more than 75%, I think nearly 80% of these both was related. The mental stamina according to astrology and this. I don't know more about astrology. My husband is expert in astrology, but I don't know much about. But there are some correlations between this mental stamina according to astrology and.
Yeah. So Raghu sir, there are researches happening. You know, there are researches happening. There are possibly publications also on it, but these publications are mostly in Indian journals or in they are not appearing in visible journals, possibly with impact factors and all that. Secondly, as I have been pointing out, there are several publications on Ayurvedic psychiatry and also its practice in medical anthropology. like possibly you would have come across articles by Mitchell G. Weiss. Mitchell G. Weiss he has been writing exponentially on Ayurvedic practice and mental health. And he did extensive studies with NIMHANS and what it has been happening in NIMHANS. And also medical anthropologists did field works in Ayurvedic psychiatry wards. And they have even written articles on it, medical anthropological work on it. And recently there was this German medical anthropologist, she did her research also in Kerala. And the most, when I was a student of medical anthropology, I was, for one of my term papers, it was for me to write, I wrote a polemic on Jean Langford, what she said. So I think anybody who has been to this stream of medical anthropology, reading what Jean Langford said, she said everything in Ayurvedic psychiatry is nothing but a mimicking of Western psychiatric practices, which is not true, which is in practice not true. Maybe she did her field work in Pune and she had the impression of that, but if she has read what just Murphy has written on it, and I don't think she will have that opinion. Ayurvedic practice has its own aspects. Of course, there is this long-going argument of purist and integrationist. Purists say, in Ayurveda itself, purists say Ayurveda should be pure. It should not be mixed with anything else. And the integrationists say, oh, well, Ayurveda is also a system of medicine, so it has to be integrated to the practices of medicine. And so we will integrate it to some amount of practice, and then we will use the Western knowledge or the medical knowledge also, but then we will practice the Ayurvedic knowledge together with this. And I think it is also the same regarding this. The Western perception of this is a little bit problematic as well, because when you see this as two epistemologically different, totally different sets of ideas in practice, and how you can mix them together is a big question for the Western academician. But in practice, I think if they have done sufficient field work, I will point that again, sufficient field work, then I think they will understand that it is quite normal for the Indian mind to accept and also work with two totally different aspects, or two totally epistemically different aspects at the same time. You would have heard Parvati madam saying of psychiatric terminologies as well. So that is also a part of mental health literacy. We are living in this world of ours today where nothing is so pure and isolated. We all are bombarded by informations coming from all directions. So Raghu Raghavan sir, who is sitting in Leicester, is bombarded with ideas of Ayurveda from here and there. Not just you, but also the general public in London or sitting in any metropolitan city in this world are searching internet how to combat COVID with Ayurveda. So this is the world which we are living today. So information is here and everywhere. So I don't think there is any point in arguing or in trying to find the black cat here. But I think I'm clear. There are many studies and researches happening. Some of them are getting published. Some of them are being used. But some of them may not be, the visibility is that enough so that the academy notices it. Sir, please be louder.
There is a purist system or not, blend all the systems in human health and human welfare, really. So we've got some questions. I'll take a couple of questions. The first question is actually the person
called Bindu, would like to know if personality disorders are discussed in Ayurveda. Dr. Parvati?
We cannot say the correct correlations because we cannot say the schizophrenia is this one in Ayurveda and the bipolar disorder is this one. The correct correlation is not possible, but depending upon the features, there are different type of personality disorder. Nearly 10 types of personality disorders are there, and according to the symptoms of each disorder, the treatment is available. And we cannot say that this 10 personality disorder, there are correct correlation of this according to Ayurveda. It's not there. Mainly our disorders are, mainly the dosha, the three dosha siddhanta is there, Vata, Pitta and Kapha. The disorders are, the mental disorders are also depending upon the involvement of these doshas. That Vata, Unmada's psychosis, Vata Unmada, Pitta Unmada, Kapha Unmada. There are different types of combination, and other disorders also are also there. And according to the symptoms, we are categorizing it, or we are diagnosing it is whether it is Vata predominant, whether it is Pitta predominant, like that. And the treatment is doing according to the involvement of dosha. So we cannot say that correct personality disorder is described in Ayurveda. It's not there. It's not like that. It's the because many personalities are described, many types of personalities. This I told you about this sattva bala, and there are gunas like sattvika, rajasa, and tamasa. Sattva guna, rajo guna, and tamo guna. And depending upon the involvement of this guna, there are certain personalities other. And the description of and these are not the correct correlation of this personality disorder. All these are different, but treatment is available depending upon the dosha predominance, and many factors are the causative factors will be are different. According to that, treatment is available, and the yukti vyapashraya, that is medicinal intervention, is available, and then the sattva vijaya, that counseling, psychotherapy, or other methods are also available. Yeah, it is there.
Any further, you'd like to comment on that in terms of the personality disorder in Ayurveda? Is there anything more for you to add?
You mean you're asking me, Dr. Raghu Raghavan?
Yes.
Okay. Yeah. So I will just add on one simple thing to what Parvati Madam has been saying. She said, it is also about the diagnostic factors in Ayurveda. So she said about Unmada. So these terminologies are totally new for possibly the gathering here. But I think if you just go on explaining it one step further, it will be very clear. So Unmada is one of the very few diagnostic terms which is used in Ayurveda. And if my final year memories is rightly there, I quote, Unmadam puna mano buddhi sapnya jnana shila cheshta achara vibramam vidyat. Am I correct, Parvati ma'am? I think she is agreeable to it. So
Smriti Bhakti. Two more.
Two more. Okay. So mana, buddhi, sapnya, jnana, smriti,
bhakti,
shila,
cheshta,
achara, vibramam vidya. That's a very long list of factors. So vibramam vidya, it's a vibrama. I hope Professor Raghu Raghavan will understand this. People from India will understand this. Vibhrama. How will you translate Vibhrama, Parvati ma'am?
Anxiety?
Impairment.
Impairment.
Smriti is memory. Yeah. Smriti, Vibhrama is the impairment in memory.
Yeah. Buddhi is
intellect, impairment in that.
Sapnya is consciousness, if I'm right. Jnana is knowledge. Shila is your attributes, how you conduct your life. Cheshta is your expression. achara is how you behave. Your behavior. Vibramam, an impairment of all this is what you call unmada. So this is the categorization of Ayurveda. Yeah, so I think it is the reverse process which is happening now. Psychiatrists should also be aware of the mental health terms in Ayurveda. I'm not say only of Ayurveda, but also of other traditional systems of medicine. It is also a way of dealing with psychiatric pluralism. Yeah, so it is often it is very important argument that I've been making in my article. Of course, it's not published, which is the global mental health project. It says there's a big gap between the knowledge on mental health in the Western society or academy with other people anywhere or elsewhere in the world. But this gap, it is a gap in if you think it is the knowledge regarding the Western epistemology of mental health. Yes, there could be a gap. But there is also a bigger gap of understanding these terminologies or epistemologies in other cultures. Yeah, it is not just about Ayurveda or India. It is about other cultures which are prominent and other human beings who are living in this world. So it is not just of being a hegemonic mental health pattern, which is important. It is also of equal exchange of ideas or equal discussion of ideas, which is important. So I will say, yes, there could be a gap, but we also have to understand that there could be other epistemologies. Thank you.
Thank you very much for that. That is beautifully explained in relation to how the human personality is actually constructed within the Ayurvedic knowledge. I think it is very enlightening to hear some of those things, because many people around the world don't know anything about that at all, really. And they often compare Ayurveda and astrology, and they put them in the same box and look at it from that perspective. So we have a short comment from Bindu, who actually asked the questions. New knowledge, and she thanks panel for that. So thank you, Bindu, for the comment. We also have another question from Lenny in relation to what percentage of patients with schizophrenia have been cured with Ayurvedic treatment alone, Dr. Parvati.
I told you earlier that the cure is, we cannot tell it's completely cured, because many factors, there are many factors which contribute for a cure. And we can say that much improvement or excellent improvement we are getting. All these are not a curable disease, but with Ayurvedic treatment, schizophrenic patients are getting an excellent improvement in their symptom level and in their mainly in the quality of life. And many of the patients, I think more than 60% of the patients in our last 3 years statistics, more than 60% of the patients got improvement in their disease condition, and they could taper the dose of the modern medication. They could control their extrapyramidal symptoms, and in the symptoms like auditory hallucination, we are getting excellent improvement in symptoms like auditory hallucinations. The other medical systems, they are telling that it's very difficult to control the hallucinations, but we are getting excellent results in this. If I telling in symptomatic assessment that we are getting good results in to control the hallucinations in schizophrenia. Almost 60% of excellent improvement, we can say.
Because whether there is a cure or is a recovery, because I think in some of the extreme states, whether it is a cure, total cure, whether it is a recovery is a different question really. In terms of
and
people,
we can control the recurrence of the disease. The recurrence is a big problem. Recurrence and relapsism is a big problem. Then if if they undergo the complete purificatory procedure like Panchakarma procedure, if the disease is so severe and chronic, then we used to tell them to continue the this purificatory procedure for 3 consecutive years to control the recurrence and relapse.
but in certain cases, you don't necessarily require a cure, a total cure, perhaps. I don't know. It's a kind of some dark concept, I think, because diabetes is not totally cured. You live with diabetes, and you're controlling the diabetes. In the same way, I think with certain states of with certain mental health disorders, you could still lead a good life with some of those conditions. You could still have a family with some of those conditions. You could still work with some of those conditions. And I think that's the concept that we need to actually have. It doesn't actually say that you have to be totally cured to get married, or you have to be totally cured to actually go to work, or you have to be totally cured to do something. And I think that's a very archaic, very dark ages way of thinking things. And I think we need to try and think about, yes, I have a condition. Yes, but am I able to live and am I able to lead an adequate life? Am I able to find happiness in my life? And I think that is very important, rather than actually trying to find a total cure for everything. Because then if there is a total cure, why haven't we cured diabetes? If there is a total cure, why haven't we cured many other conditions? We live with it, we control it, we manage it well. And I think that is a way we need to try and look at maybe kind of a recovery model of things. And that's where the pluralism comes in, and the Ayurvedic perspectives actually comes in too. We also have another question on the chat box, just from Archa. Looks at, does Ayurveda use multidisciplinary approach for treating mental illness? Dr. Parvatheedevy again, because you are actually more in a clinical practice of things. Do you have a multidisciplinary model?
Madam, you're mute. You're mute.
There are 3 approaches for mental disorder. For all diseases in the treatment, there are different approaches. In this psychiatry, there are 3 approaches. That is one spiritual approach, that is Daiva Vyapashraya, and one purely medical, that is Yukti Vyapashraya, medicine and treatment and procedures. And the other is Sattva Vajaya, that is counseling techniques, counseling and therapeutic to improve the mental stamina. These 3 type of treatment are essential for a cure of the mental disease. For the people who are believing in spiritual factors, they have to undergo some, I told you earlier that they have to undergo some spiritual healing techniques for their relaxation. Or if they are thinking that some papa or some evil spirits are there, or some sin is there, they have to undergo this type of some spiritual therapies. Then they have to undergo pure physical treatment to clean their body and their mind. And then they have to improve their mental stamina to control or to prevent the disease. So these type of approaches are essential for the cure of a mental disease.
But do you have Hari, Dr. Hari?
Yeah. Can I add a word? I think she also meant possibly this biomedical approach, the newest approach, where you have the psychiatrist, then you have the psychologist, and also the psychiatric social worker. They do the consultations together, and they have this multidisciplinary team dealing with it. So maybe that is the approach which she would have been pointing out, or maybe thinking about. But my humble request for that perspective is to read the work of Murphy Halliburton. See, he says the space, the healing space, that is very important. So it is not just the Ayurvedic practitioner there. You have the therapist there. You have the people who are the family members there. So, so the multidimensional or multidisciplinary team for the Ayurvedic cure could be different from the conventional cure. And interestingly, in ritual healing or temple healing, it is again different. So you first go to the astrologer. The astrologer will give you a list of things to do, including going to temples, doing offerings, n number of things. And it was very interesting when I was doing the field work in Pungudilmana. The healer, Devan Nambudiri, he will ask, do you have a list? So that is a word, I quote. He asked, do you have a list with you? So this list could be the prescription of a biomedical doctor. It could also be the writing of an astrologer. It could be any list. So he will consider all of them with equal status and go through them and then make his decisions or his advices. That was very interesting. People stand in the same queue with prescriptions from their biomedical doctors at the same time with astrologers' prescription. So they all are equal, all have equal weightage there. And then he will do his ritual anyhow. So that is so in Pungudilmana, the multidisciplinary approach is the mana as a healing space, then the healer there, and then the mediation of the astrologer. So it's a totally different set of multidisciplinary enterprise coming in. So that also is pluralism. Pluralism or multidisciplinary pluralism is not just the psychiatrist, psychologist, and the psychiatric social worker. It could also be the healer, astrologer, and the Ayurvedic physician as well. Why not? Thank you.
I think it's whether we should actually try and adopt the term of creative practices here, because I know creative practices are actually often used with arts and other stuff. Because this is actually a different way of actually looking at things. Because I think there are some things that cannot be explained within the traditional modern medicine. And I think modern medicine has limitations, many limitations. Obviously, if anybody is actually familiar with the work of Ivan Illich and the book of Limits to Medicine, would even though it's a 70s book, it's one of the classic works in relation to how the health industry creates more diseases than that we know of, really. So I think it's important to actually put that in context as well, because there are no one system. There is no one system that has got even though one system has got the monopoly, but there is no one system that answers everybody's needs and wishes, really. And I think so a range of things might be helpful. And I think the other thing is actually also how, who are we to actually try and criticize that? You shouldn't not be going to an astrologer. You should not be going to the traditional practitioner. You should not be going to an Ayurvedic practitioner. But I think if I want to actually find happiness, if I want to find meaning about my own condition, then I can go to anybody. It is none of anybody else's business to actually understand, what is it that you're actually doing. As long as I have faith in that system, that is what is more important. If I have faith in the modern psychiatry, then I go to there. If I think that I have some faith in modern psychiatry and some faith in Ayurveda, then I mix them both. And if I have, on top of that, as Harry said, if I want to see astrologists and other things, then I would do that too. But I think it is up to the person. And I think I have the choice. And I have the choice and the independence to actually do that. And I think, but just to the peer group pressure in terms of criticizing that attitude is not civilization, I must actually say. It is because of the ignorance that people try and actually look at that, because many of those things actually comes from ignorance. They don't know what Ayurveda is. They don't know what the practices are. And I think that it is because of lack of knowledge and lack of awareness from many people within the Indian context, many people from the international context as well. So I think it is a fascinating field, fascination of discussion in terms of the different systems and how people look upon. I can understand some of the things that
you're actually saying, Dr. Parvati and Dr. Hari, because I'm, from childhood days, I've heard some of those terms and have understood some of those terms. But for many people, there might be strange things and strange ways of actually looking at things. But I think it is important that we try and have an open discussion about how the various systems can actually influence and be a helpful modality in terms of addressing and also for treating the condition of any form of mental health disorders. But I think what is widely lacking within the field of Ayurveda, maybe I'm very ignorant about this myself, is a kind of research here in relation to trying to provide available evidence in relation to some of the questions in relation to how many have been treated, or what's the outcome of a particular disorder, what's the outcome of a particular condition, and what are people's experiences, etc., under these treatments. Maybe there is limited publications on it, or if there is publications, it is not available to the many, because of the Western journals have a monopoly on all these things, and then they don't want to know, they don't want to show the entire world all those things. There is politics as well in terms of how we speak about all those things. So I don't know. I think that's an area. I don't know. How would you like to comment on that, both Dr. Parvati and Dr. Hari, in terms of the need for more research and more evidence and more publications for enabling people to understand this, because we need the right kind of information, right kind of knowledge.
Yeah, I think the publications are very less. But nowadays, researches are going on and more publications are coming. And one more thing is, what we are lacking is the emergency care. The emergency, if a patient is very aggressive and he is not willing to take the medicine, we can compel them to take medicine. But if he is not at all willing to take medicine, it's very difficult for us to treat, because there's no injections, there is no ECTs like that. They have to take the medicine, or they have to undergo the treatment procedures. For aggressive patient, if after compelling him, if he is willing to take the medicine, then we can do treatment to control his aggression and all the other symptoms. But taking the medicine and undergoing the treatment, that's somewhat difficult. If the patient is not at all 100%, he is not willing to undergo the treatment, then it is difficult for us. That is a limitation. And the emergency care, okay, that's right. If a person is coming like that, and but in a sudden aggression like that, it's very somewhat difficult to control. But once he's ready to take the medicine, or once he is taking the medicine, or once he is undergoing ready to undergo the treatment, then it's easy to control. Or if a patient is impulsive, then there are certain intervals. We can do treatment in that intervals. But if a person is fully aggressive in all times, then it's very difficult. That's a lack of emergency care is one of our area of.
Briefly, because we have a few more questions that I think we could go through as well. Thank you. Are you able to comment on the research element?
Yeah, I think I already made a comment on that. The researches are happening, but may not be that visible. And also, I pointed out that there are researchers from anthropologists, medical anthropologists. They also come up with researches. I think I have pointed out that.
Okay, thank you. So we also a few more questions. We have 10 minutes. And I think we have a question from Suhas Kumar Shetty. the role of Ayurveda in preventing mental disease, and I think that we kind of briefly touched on it. Is there any role for Ayurveda in preventing mental disease?
In Ayurveda, we cannot differentiate mental health and physical health. We cannot say it's two separate. It's not two separate entities. In the definition of physical health itself, the mental psychiatric elements are there. With physical fitness, the fitness of mind and all the faculties are there. And if we can improve the mental health and to control mental disorders or to prevent mental disorder, it is saying that nivirta amisha madhya. If we control intake of non-vegetarian food and alcohol, and if we can control our desires, if we can mentally control our desires, then the nivarta amisham hidashi prayada shuddhi. If we keep cleanliness or keep hygiene in our physical and mental activities, then we can control mental disorders and we can improve our mental health. There's a definition in there's a quotation in our text. It's like that. And some description of some particular food materials are there to improve mental health. There are certain, and achara rasayana, there are certain description of certain mental hygiene, how to improve our mental hygiene. There are certain descriptions in our text. It's there.
Yeah, I will add up a little bit there. Preventing mental issues. First point which Parvati madam has been saying, Ayurvedic knowledge says the body and mind are extensions of each other. You don't have a big separation between that, first of all. And so everything which affects the body will be affecting your mind as well, and vice versa. So if you keep good care of your health, then generally you're mentally healthy as well. And then, having said that, the three concepts of gunas, again, is very interesting. It says you have a sattvic aspect, you have the aspect, a purity aspect, you have a very active, aggressive aspect, you also have a very dark aspect. So we all have all these aspects. We all have the gods, the demons, and also the warrior, the fighter in you. Yeah, we are sometimes godly, sometimes we are demonly, but sometimes we are also ardent fighters. All these three are there in all of us. And Ayurveda say, if you are more sattvic, if you are more godly, you nurture your godliness, then you are preferably mentally healthy and well, which is true. And I was very interestingly hearing what Parvati madam has been speaking. If you are saying this to a wider audience, Ayurveda consider consuming alcohol and having non-vegetarian food causes mental illness. This is a very cultural, note, and then that itself creates a big havoc and a big discussion here. But of course, I hope you understand why this comes, why this discussion comes. It comes from this aspect. If you are godly, then you don't consume alcohol. If you are godly, then you don't consume meat, because you have to kill an animal to have the meat. So your godliness should be nurtured. Your warrior aspect, your aggression should be controlled. The demon in you should be controlled. Then you are mentally healthy. That is, in a nutshell, simply what Ayurveda says. I hope it makes sense. I will not say more about it. Thank you.
Wants to actually take some alcohol from time to time anyway, but that's besides the point. Anyway, I think Suhas Kumar Shetty again says that rightly said in terms of the condition. Thank you for that. And finally, the other question was actually also from Suhas Kumar Shetty about medical professionals should be trained in the medical pluralism. I think that is very true. I think that is very important that all pathways, I think in India is far, far better than in the Western world, because in India, if you go and see a medical practitioner, they would actually say, avoid this food, avoid that food, and we'll go and, Ayurveda is far better. There is that pluralism existing in the Indian context to a certain extent, and I think you don't find that anywhere else. I think finally, there's another question by Suhasini Nantika. My mother is chronic schizophrenic for the last 30 years on regular treatment. She continues to have auditory hallucinations. And can she take Ayurvedic treatment as an adjuvant? And if so, where to approach in India? We have to answer this in 1 minute.
Then she can come to Government Ayurveda Research Institute for Mental Diseases, Kottakkal. She can undergo IP treatment there. Yeah. I know. No, but now, because of this COVID situation, we are not admitting patients from out of state. Once it is over, we can provide treatment for her.
Yeah, thank you for that. And I think it's been, we are nearly coming up to the time. We had an hour and a half of discussion on Ayurvedic practices, and I think we need more time. Perhaps we need to reschedule it on a different platform, and on the same platform, but from a different context and different title, perhaps. But I think it's been a great pleasure to talk to you, Dr. Parvatheedevy and Dr. Hari Bhaskar. It's been, and also share the wealth of knowledge and information and the kind of traditional systems. There are, if we talk about the tried and tested medicine, but Ayurveda, I keep saying to everybody, Ayurveda is a tried and tested medicine because it's been there for time immemorial, and now for a number of years, really. So, and I think much more than what Western medicine knows, because I think so it's important to try and see from a holistic perspective, and how things could actually work out for certain people, systems of medicine that might be that be applicable for certain people, choices of individuals, etc. All those things are very important. So, and I think it adds a different layer in terms of our knowledge or awareness, our understanding about how Ayurveda, I mean, the little conversations that we have had so far has enlightened me, given me more and more food for thought in relation to how Ayurvedic practices might actually influence some of the work that we currently do, and the amount of work that still need to be done in relation to in the field of mental health. Really, I'm sure I'll be knocking on your doors for a grant application soon in relation to that. So thank you very much for that. I'm very grateful for you for taking the time from your practices to actually spending time with us on this discussion. And thank you very much. I'm very grateful to you both to be on this platform for our project and trying to shed the knowledge and awareness on Ayurveda. So many thanks, and we are nearly coming up to the time, and hopefully we would meet again, and we would have another opportunity to discuss this again, perhaps virtually or face-to-face in a conference, perhaps, or a virtual conference, perhaps. All those things are actually on all possibilities. So thank you for the audience, for the interaction, for asking all the questions and then commenting on things as well. I mean, it's very, very useful for us to see how people are actually understanding some of those things, and I'm sure you can interact with us on MeHeLP webpage, on MeHeLP Facebook page, and also on our YouTube and Twitter as well. Finally, my many thanks to our digital consultant, Pradeep, for organizing this webinar. And this will be streamed live on Facebook, and also this will be recorded and will be available on Facebook as well. So many thanks, and have a good evening from the UK, and have a good night in the Indian context, and also pray to all of you so that we get through this crisis in the pandemic pretty soon. And keep well, keep safe, and think positive.
Thank you, sir. Thank you very much, sir.
Thank you. Thank you. Thank you. Thank you, sir.